Hi, Dr. Peter Montgomery, family practice doctor, here to give another COVID update. It is April 16th, Thursday, and I'm going to talk a little bit more about where we are on cases, how the peak is flattening in the number of cases, and how the death rate is lagging on that, but that will be coming down soon. And talking what a lot of people are talking about, which is herd immunity and what that means and how we still need to be hanging in there for a vaccine and better treatment plan to help out with that. So let me get to the computer screens and show you how things look now. I'd like to start off with the U.S. health weather map brought to us by Kinza and their app-enabled, downloadable, uploadable weather data of temperatures around the world, or at least the U.S. And this is up to date for today. Not much has really changed. It's really the same basic pattern showing where we have clusters of people and where it's been the worst up here in the New York, New Jersey, Connecticut, Massachusetts, East Coast area. And again, worse in Florida. Um, uh, Southern Michigan has had a bad. Detroit here. Chicago is here at Cook County. The South has picked up a bit and has some hot spots in concentrated areas. Louisiana, Texas, I'm here, Missouri, we kept it pretty cool. Kansas City's getting a bit hot. Phoenix, California is the coolest, and thank goodness because it's one of the most populated areas that's doing well. And up here, up into Seattle. So the pattern really hasn't changed much. They have improved this observed, which is showing increased temperatures here in East Texas up into Oklahoma, a little bit here in the south here, still the hot spot there. So that's showing us the overall, well, how things actually are. The trends actually cooling here, at least in the Connecticut area, cooling through the Midwest, but actually still warming up here in the Texas, Oklahoma area. The world, looking at the world cases, hitting a quick update on here. The world cases are leveling off in the countries that are reporting well. Some of the larger countries are still just starting to pick up with it. India and Pakistan, Bangladesh, in that area where it's very concentrated. But the world cases, it keeps trying to do a little spikes up, but the logarithmically that is flattening back out. Here's China's experience with logarithmic bending the curve, flattening out. The rest of the world, Europe, getting infected and then flattening out. But there's still large parts of the world where the testing is not being done significantly. And so these numbers will become less and less meaningful. The U.S. cases, we are starting to flatten out here. We had the logarithmic scale for a while. For a while, we actually had to calm down for a while, but it did what viruses do. And then we started mass shutting things down finally around here and actually flatten the curve out a little bit better by doing so. But it keeps trying to spike up. We're seeing, I think what happens is different metropolitan areas are getting their last big spikes, and then before calming down, that's probably New York, Louisiana, Chicago, Detroit. As it starts hitting areas, as it seems those spikes seem to be going across the country from east to west. We're still doing a very good job of testing over 100,000 a day for several weeks now, or at least since March 31st. So yeah, for 2 weeks of over 100,000 a day testing. So giving us a good sampling that our numbers are accurate. The world meter on cases, again, by large countries, I would start with Spain. These very small countries, the numbers are skewed. Spain has overtaken Italy, and Belgium, sadly, is way up there as deaths per million. This is the most accurate number because cases are widely variable to how much testing there was, but deaths are very accurately reported in hospitals and morgues. There's a lot of people dying at home and it's not being recorded, but of course that's also a very consistent number, and they're doing a better job of tracking those. So yeah, again, Western Europe hit worse harder than Eastern Europe, almost in a smooth gradation that the more you went east in Europe, the less severe it got. And the more south you went, the worse it got. Here's the world average at 16 per million of the countries that are documenting things well. The U.S. is up here, and we can actually click on the U.S. and then zoom in on a state-by-state basis. Again, with New York clearly having twice as many as the worst next state, New Jersey. Let me actually get those in order. Connecticut, way up there too, which is basically the suburbs of New York, and Louisiana, Michigan, Massachusetts, on down. And so then you can look on this map and find your state. I'm in Missouri. We're down here at 28 per million, done very well. Actually, we're not near our peak. I think we're at our peak cases, but we're not at our peak hospitalization yet, based on the chart. You can get more of that information here by the site brought to you by the University of Washington. And they're showing our hospital bed and ICU bed storage, and almost all that is in New York, New Jersey, Connecticut, and the Boston area, Massachusetts. So the rest of the country, we actually have sufficient beds and ICU beds handling what's left. And again, the U.S. hospitalization peak has happened, and things are going down. I am going to hit refresh on that. That chart looked a little odd. Okay, there we go. And so, here we are, April 16th, and showing that. And again, you can break that down by your state, and I did that. And the estimated U.S. deaths been tracking right along on that, and then predicted is about 68,000. It had been as high as 80, as low as 60. As information is coming out, we're doing a pretty good job of lowering that number. There's been a lot of talk about herd immunity, and found a very sobering article saying that's really not something to wait for. The math is not very encouraging. So based on the infectiveness of the disease, the R naught number that you may have heard about, very infectious diseases like mumps, the R naught is over 10, and that means you got to get up to 92% of the population to have the disease to stop it from being very common, and that's really only achievable with vaccines, and we've done that. We calm that down. The R naught for COVID seems to be around 3, and their calculations, it would take 70% of the population immune. And to show why that's not a good thing to wait for, roughly the U.S. population here, 330 million. If you take it 70% of the population being infected, that means 230 million people have to be infected with, and I'm being generous, with a death rate of 0.5%. That's a lot of people. I did that math there a little wrong. Forgive me as I hit the wrong button right during my demonstration time. 0.70% of the population with a death rate of 0.05%, 5 times worse than the flu. You get that number. Let's say it's equal to the flu, not 5 times as bad as the flu, but divide that number by 10. Let's say it's only equal to flu. It's still a really horrible number of people that have to be sick and die to get that. So waiting for herd immunity is not a positive thing to wait for. We're going to need a vaccine and need it soon, and that's still looking at about this time next year. Our treatment's getting better, so I think that we can get that number down from 0.05% down to 0.01%. basically influenza level. But they're working on that. Actually, some positive information from the company Gilead. Their drug they invented for HIV, and this drug is similar in that it's an RNA virus uh, that it was actually shown to be positive results from a very preliminary trial that's still going on. We are getting better with our treatment plans, and again, the treatment plan from one university published theirs online, and we're getting better at it. So that we need to keep working on the social distancing, keep working on washing, waving, wiping, and whoa, don't touch your face. Do what you can to be the most excellent version of your health. Eat right, exercise, stop smoking, stop drinking. Eat your healthy food, your fruits and vegetables. Get the vitamin C and quercetin, which is in a lot of your brightly colored fruits and vegetables. Zinc supplement's not a bad idea. You can get that from a multivitamin. Melatonin you get from good sleep, or again, you can take a supplement. Vitamin D3 you can get from sunshine if you get a sunny day and a warm day, or again, a supplement. These are things you can do to boost your immunity in general. It will not cure you, but it can help you have a less severe episode of a viral infection in general. These are just general advice. If you're sicker, obviously go to the hospital, consult your doctor. The treatment plans are much better worked out than they were 3 months ago, even better than they were even a month ago, and constantly resharpening our assessment and reanalyzing what works best. Because again, if something's not working, you have to change what we're doing, and that is a daily, hourly, minute by minute thing that we're working on. So everybody hang in there. I'll give another update another day or two, and we'll see how as we go. Hang in there.